Welcome back, everybody. Today, we're going deep on this pretty cool medical lecture from Vietnam.
Oh, cool.
Yeah, it's called Dinam Tum Ovong Nay, Nent Beat Fan Diction Canon.
Wow. That's a mouthful.
I know, right? But it basically means like electrocardiogram of atrial fibrillation, recognition, analysis, and diagnosis.
Okay, so we're talking about ECGs and AFib. Got it.
Exactly. So like imagine you're handed an ECG, right? Like this map of someone's heart's electrical activity.
Yeah.
Could you figure out if they have AFib?
I see where we're going with this.
That's what we're going to figure out today.
Awesome. I always feel like I need a decoder ring for those ECGs sometimes.
Uh-huh. Yeah, they can be tricky.
This lecture, though, it's not just about spotting AFib. It helps you actually get WHY, the heart's going haywire electrically.
Okay, so let's break it down first. What exactly is atrial fibrillation?
So picture this.
Wow.
Your heart has this natural pacemaker, the sinus node.
Yeah.
It's like the conductor leading an orchestra. But in AFib, the conductor vanishes, and all the instruments just start playing out of sync.
Creating total chaos.
Exactly. It's not a nice coordinated beat anymore.
Oh.
The atria, the top chambers of the heart, they just quiver instead of beating properly.
So the heart's not pumping efficiently then?
Nope. And that can cause some problems like blood clots forming in the atria.
Yikes. So how do we actually see this musical mayhem happening on an ECG?
Good question. The lecture points out a few key signs.
Okay.
The first one is missing P waves.
P waves.
Normally, those show you the organized activity coming from the sinus node, the conductor.
Right.
So when they're gone, it's like an empty podium. Nobody's leading the orchestra.
Makes sense. What else do we look for?
You'll see these squiggly lines called F waves.
F waves.
Yep. Think of those as the visual chaos of the atria going wild.
Like seeing the sheet music all over the place.
Exactly. And they're easiest to spot in lead V1 on the ECG.
Okay, so no conductor and a messy score. Got it.
Right. And then there's the heartbeat itself. It's irregular, like you'd expect.
But is there a specific kind of irregularity with AFib?
There is. We call it irregularly irregular.
Irregularly irregular. That sounds complicated.
It just means the heart rhythm is totally unpredictable. There's no pattern between the beats.
Ah, I see. So not just any old irregular heartbeat.
Exactly. And you can see this on the ECG by looking at the RR intervals. They'll be all over the place.
So we've got the missing P waves, the F waves, and the irregular rhythm. Is that pretty much it for AFib on an ECG?
Well, there's more to it than that.
Okay.
AFib isn't always the same. It can show up in different ways.
Oh, interesting. Tell me more.
So it can present with a slow heart rate, a normal one, or even a fast one.
Ah, so there's a spectrum of how it can manifest.
Exactly. And that affects the symptoms too.
I imagine a fast heart rate would be more noticeable.
Definitely. Fast AFib, it can cause more severe symptoms like your heart racing, feeling faint.
Makes sense. It's working overtime.
Yeah, because the heart has less time to refill with blood between those rapid beats.
Oh, I see. What about slow AFib then? Any concerns there?
Well, it can sometimes be a red flag.
A red flag. How so?
It might mean there's something else going on, like a medication overdose.
Oh.
Or it could point to a problem with the heart's electrical system, something called heart block.
So even within this irregular rhythm, there are clues to uncover.
Right. And the lecture even goes into some of the subtler ECG findings, too.
Oh, even more details to look for, like what?
Well, for instance, if the F waves have a really big amplitude, really tall, that could mean the atrium is enlarged.
An enlarged atrium, is that bad?
It can be a sign of something else going on, like a problem with one of the heart valves.
Oh, I see.
Then there's this rare thing called regularly irregular AFib, which is kind of contradiction.
Regularly irregular. How does that work?
It's when the signal between the atria and ventricles gets blocked.
So the top and bottom chambers aren't communicating properly.
Right. This can happen with digoxin toxicity, for example.
Digoxin toxicity. Is that serious?
It can be. Digoxin is a medication used for some heart conditions, but taking too much is dangerous.
Makes sense.
So that's why it's super important to know the signs of toxicity, like nausea, vomiting, even vision changes.
Oh, wow. I had no idea.
If you're on digoxin, definitely talk to your doctor about it and mention any weird symptoms.
Good advice. So we've got these larger Fock waves and the regularly irregular pattern. Anything else tricky to spot on the ECG?
There's also this thing called the Ashman phenomenon.
Ashman phenomenon. Never heard of that.
It creates this weird QRS complex on the ECG. It kind of looks like a premature ventricular contraction.
So it's like a false alarm then?
Basically. You could mistake it for something more serious if you're not careful.
Wow. So interpreting an ECG is like detective work.
It really is. But the more you learn about how the heart's electrical system works,
Uh-huh.
the more those patterns on the ECG start to make sense.
And the lecture emphasizes that the ECG is just one piece of the puzzle, right?
Absolutely. It's like a clue, but you need more information.
So what else is important to consider?
You got to look at the patient's whole medical history, their symptoms, any other test results.
It's about connecting the dots.
Exactly. Putting it all together to get the right diagnosis and treatment plan.
Makes sense. It's not just about seeing AFib, it's about understanding the whole context.
Right.
So speaking of context, what are some of the common causes of AFib that the lecture mentions? What should people be aware of?
Well, the lecture talks about a bunch of things that can contribute to AFib.
Okay, like what?
Heart valve disease is a big one, especially mitral stenosis.
Mitral stenosis.
Yeah, it's like one of the doorways in your heart is narrowed, so blood can't flow through easily.
Ah, that makes sense. And I bet that's where those big fifth waves on the ECG come in.
You got it. It's a red flag that something's up with the valve.
So that's one thing to watch out for. What else?
Then there's the usual suspects like hypertension and coronary artery disease.
Oh, right. Those are pretty common, aren't they?
They are, unfortunately. And they put a lot of strain on the heart over time.
So it's like wearing down the engine.
Exactly. All that extra work can damage the heart and make it more likely to develop AFib.
Makes sense. You know, one thing that surprised me in the lecture was the link between AFib and COPD.
Yeah, that one's not as obvious, is it?
Not really. I mean, what does lung disease have to do with the heart?
It's all connected, you know? When your lungs aren't working properly, like in COPD,
Uh-huh.
your heart has to pump harder to compensate.
Oh, I see.
And that extra stress can lead to changes in the heart's structure, making AFib more likely.
Wow, so it's like a domino effect.
It really shows how interconnected our body systems are. You know, you can't just look at the heart in isolation.
Good point. So besides heart valve disease, high blood pressure, and COPD, are there any other surprising culprits for AFib?
Well, an overactive thyroid, hyperthyroidism, can be one.
Really? I wouldn't have thought of that.
It's often overlooked, but it can definitely contribute to AFib, especially the fast kind.
Interesting. And of course, just getting older increases the risk.
Yeah, it does, unfortunately. It's just natural wear and tear on the heart over time.
So it's a mix of lifestyle factors, underlying conditions, and just the aging process.
Pretty much. You know, the lecture also goes into detail about diagnosing AFib.
Oh, yeah. How does that work?
It's not just about the ECG.
Right. We talked about that.
It's a whole process.
So what else is involved?
Well, first, the doctor will take a thorough medical history, ask about any risk factors like diabetes, and then they'll do a physical exam looking for specific signs.
What kind of signs?
Things like peripheral neuropathy, which is nerve damage in the feet.
Ah, that's common with diabetes, right?
It is. And it can make it harder to feel injuries on your feet, so you might not notice them right away.
Yikes. That sounds dangerous.
It can be. The doctor will also check for foot deformities, ulcers, things like that.
So they're looking at the whole picture, not just the heart.
Exactly. And they'll assess the blood flow to your extremities.
Blood flow to the feet. Why is that important?
Well, if the blood flow is reduced, it could be a sign of peripheral artery disease.
Another risk factor for AFib?
Yep. The lecture even gives specific instructions on how to check for this, like feeling the pulses and using a Doppler ultrasound.
Wow, they really go into detail.
They do. And of course, blood tests are also important.
I was going to ask about that. What do those show?
They can help confirm the diagnosis and rule out other potential causes of the symptoms.
So it's like putting together a puzzle, all these different pieces of information.
Exactly. The ECG, the physical exam, the blood tests, it all adds up to a complete picture.
Makes sense. So once AFib is diagnosed, what happens next? How is it treated?
Well, the lecture outlines a three-pronged approach.
Three-pronged. Sounds comprehensive.
It is. First, you got to control the heart rate.
Okay, that makes sense.
Then you got to prevent blood clots from forming.
Yeah, we talked about that risk earlier.
And finally, you got to address the underlying cause of the AFib.
So it's not just about managing the symptoms, it's about tackling the root of the problem.
Exactly. It's a holistic view of the patient's health.
I like that. So how do doctors typically go about controlling the heart rate in AFib?
Medications are usually the first line of treatment.
What kind of medications?
Things like beta blockers and calcium channel blockers.
I've heard of those. What do they do?
They help slow down the heart rate and reduce those uncomfortable palpitations.
So they're like putting the brakes on a runaway train.
Uh-huh. That's a good way to put it. It's about getting that chaotic rhythm under control, even if it's not perfectly normal.
Makes sense. And what about preventing those blood clots? I know that's a big concern with AFib.
It is. Anticoagulants or blood thinners are essential for people with AFib.
Blood thinners.
Yep. They drastically lower the risk of stroke.
Because those clots in the atria can break loose and travel to the brain, right?
Exactly. And that can cause serious damage.
Scary stuff. So blood thinners are really important for preventing that.
They are. Literally lifesavers in many cases.
But I imagine there are different types of blood thinners, right?
There are. And which one is best for you depends on a lot of factors.
Like what?
Your overall health, your risk factors, your medical history.
So it's a personalized decision.
It is. The doctor will work with you to figure out which blood thinner is the best fit.
Okay, so we've got meds to control the heart rate and prevent clots. What about addressing the root cause of the AFib?
That's where things get really interesting.
How so?
Well, it depends on what's causing the AFib in the first place.
Makes sense.
For example, if it's hyperthyroidism, treating that might solve the problem.
Oh, so the AFib might go away completely.
It's possible. Or if it's heart valve disease, you might need valve repair or replacement.
Ah, so sometimes surgery is necessary.
It depends on the severity of the problem. But the key is to treat the whole patient, not just the symptom.
I like that approach. It seems like managing AFib involves a whole team of specialists.
Often, yeah, you might have cardiologists, electrophysiologists, endocrinologists, maybe even surgeons all working together.
Wow, a real team effort.
It is, and it highlights how important it is to have a good relationship with your doctor, someone who can coordinate your care.
Good point. Now, besides all these medical interventions, does lifestyle play a role in managing AFib?
Absolutely. Lifestyle changes are huge.
Huge how.
They can really make a difference in how you feel and how well you manage the condition.
So it's not just about what the doctor does, it's about what you do yourself.
You got it. The lecture stresses the importance of taking ownership of your health.
I like that. So what kind of lifestyle changes are we talking about?
Well, a lot of the usual suspects,
Like what?
Maintaining a healthy weight is super important.
Yeah, obesity puts a lot of strain on the heart.
Exactly. And regular exercise is key too. It strengthens the heart muscle.
But for someone with AFib, wouldn't they need to be careful about what kind of exercise they do?
Oh, for sure. Definitely got to talk to the doctor about that.
Get a personalized plan.
Right. Something safe and appropriate for their condition.
So it's about being informed and making smart choices.
Exactly. And diet plays a big role too.
Oh, right. What kind of diet is best for people with AFib?
Pretty much what you'd expect. A heart-healthy diet.
So lots of fruits and veggies.
Yep. And whole grains, lean protein, all that good stuff.
And cutting back on salt.
Right.
Yeah.
Big time. Too much sodium just makes high blood pressure worse, which is already a risk factor for AFib.
So it's those classic healthy eating habits we hear all the time, but they really do matter.
They really do. And the lecture also mentions alcohol.
Oh, right. Alcohol can be bad for the heart.
It can, especially if you drink too much. It can actually trigger AFib episodes in some people.
So moderation is key.
Definitely. So we've got healthy weight, exercise, diet, alcohol, and there's one more big one.
Okay, what's that?
Stress management.
Stress. Seems like it's linked to everything these days.
It really is. And it's a big factor for heart health, too.
But how does stress specifically affect AFib?
Well, when you're constantly stressed out, it throws your body's natural rhythms out of whack. And that can lead to all sorts of problems, including heart issues.
Like triggering an AFib episode?
Exactly. So finding ways to manage stress is crucial.
Yeah, that makes sense. What does the lecture recommend for stress management?
They talk about things like mindfulness, meditation, yoga, those kinds of practices.
So it's about taking care of your mental and emotional well-being, not just the physical stuff.
Right. It's all connected, mind and body.
This deep dive has been super interesting. We've learned so much about AFib, from the ECG patterns to the treatment options to the lifestyle changes.
It's been a great discussion. I think the biggest takeaway is that AFib is more complicated than a lot of people realize.
I agree. It's not just an irregular heartbeat. It's a whole condition with various causes and potential complications.
Exactly. And that means the diagnosis and treatment have to be tailored to the individual.
Right. There's no one-size-fits-all solution.
Nope. You got to consider the patient's age, lifestyle, other health issues, everything.
It's about treating the whole person.
Absolutely. It's interesting that this lecture is from Vietnam.
Yeah. What did you think about that?
I thought it was cool how much emphasis they put on patient education.
Like empowering patients to understand their own health.
Exactly. The lecture really encourages doctors to explain things clearly, involve patients in decision-making.
That's great,
Yeah, it's a more collaborative approach to healthcare.
which is definitely a good thing.
It is. It recognizes that each patient is unique, and the treatment plan should reflect that.
And that's especially important with AFib, where there are so many different factors to consider.
For sure. You got to personalize the care.
We've talked a lot about recognizing AFib on an ECG, but some of our listeners might not even know what an ECG is.
Oh, good point. Want me to give a quick explanation?
Sure, that'd be great.
So basically, an ECG is a recording of your heart's electrical activity.
Okay.
It shows those electrical signals that control your heartbeat.
And doctors can use that information to diagnose all sorts of heart conditions.
Right. Including AFib. It's a really valuable tool.
So those squiggly lines tell us a lot.
They do. And the best part is, an ECG is a pretty simple test.
Non-invasive. Right.
Yep. And relatively inexpensive, too. So if you're having any weird heart symptoms like palpitations or dizziness,
Definitely talk to your doctor about getting an ECG.
it's a good first step to figure out what's going on.
Couldn't agree more. This deep dive has been fascinating. We've covered so much ground.
We have. We learned about those intricate electrical signals in the heart, the importance of personalized care.
And the power of lifestyle changes.
Absolutely. I think this lecture from Vietnam provides a great model for how to approach AFib.
I agree. It emphasizes knowledge, collaboration, and patient empowerment.
All essential ingredients for better heart health.
So if you had to pick one key takeaway for our listeners, what would it be?
I'd say this. Don't underestimate the power of knowledge when it comes to your heart.
Meaning?
The more you understand about conditions like AFib, the better equipped you'll be to advocate for yourself, make good decisions about your care.
So it's about being informed and proactive?
Exactly. Take charge of your health.
I love that. Well, on that note, we want to thank all of you for joining us on this deep dive into the world of atrial fibrillation.
It's been a pleasure.
We hope you found it insightful, maybe even inspiring.
And most importantly, we hope you learned something new about keeping your heart healthy.
Until next time, stay curious, stay informed, and take care of yourselves.